Laura. And Rob, I just need host presenting privileges, please.
There you go. It's all yours.
All right. Can you see my screen?
All good.
Great. Well, thank you so much. I'm pleased to be here, and thanks for the opportunity. What I wanted to talk about today is what we at Virgin Pulse believe is the new workplace agenda for employers, which is really how do you innovate in a pandemic world. We have millions of members all around the world that are using Virgin Pulse employee health and well-being solutions. We've got thousands of clients. And during this last 6 months, we've learned a lot about what employees are looking for and how employers are adjusting to this new normal. And so I'm excited to tell you a little bit more about it. So not to start off today's event on a down note, but one of the things that we've learned from the data that we've collected and the conversations we've had with people all around the world is that everyone is suffering. And it's not just the folks that have gotten COVID and their families that are suffering. It's really all of us. This is a once in a century black swan event that's happened. And even in some cases where we don't realize it, our health, our well-being is suffering in tremendous fashion. And we've seen this in the data. I want to share with you some of the data that we've collected about just how much people are suffering. 75% of our members in a survey that we issued about 2 months into the COVID pandemic told us that they're more stressed than they were prior to the pandemic. And 60% said that they're significantly more stressed. We've been collecting billions of data points on our members for the past 15 years. We've never seen this type of increase in any health risk factor or in any metric in such a short period of time across such a large population. So there really is a significant mental health crisis going on. And really, it's driving anxiety and depression. In the US specifically, where our headquarters is, we have data that shows that anxiety and depressive symptoms have more than tripled year over year. And Black and brown communities are most acutely impacted. So there's a mental health crisis going on. There has been, and COVID has certainly accelerated it. We've also seen that the pandemic has exposed health disparities. We talk a lot in healthcare about the social determinants of health, the fact that your race and your education level, your income, your zip code, even where you live, determines your health in many ways, more so than the care that you receive in the doctor's office. And COVID-19 has really pulled the curtain back and shown us just how much the social determinants of health impact our risk factors and our long-term health. And of course, Black and brown communities are being hit the hardest. We also see that people are postponing medical care. So they're afraid to go to the doctor. They're afraid to go to the hospital. They're avoiding very important care. And that means that they're not getting the chronic condition management that they need. They're not getting their preventive exams. They're skipping out on their screenings. They're not getting their vaccinations. And this is having a deleterious effect on their health. When it comes to food, our members, 42% of our members tell us that their diet has gotten worse. You've probably heard the terms, the quarantine 15 or the COVID-19, those are kind of facetious terms, but the reality is that people are eating much worse. They're home, they're stress eating, they're eating constantly, they're snacking, and they're gaining weight. This is happening all around the world. We also see in the data that people are sleeping less and they're moving less. And maybe some of you are in that boat. I certainly am in that boat. We track data around the world, and what we saw as the rolling lockdowns happened back in March, country by country, we were able to see in each of those populations, immediately when that lockdown happened, that people started to sleep less, they had more disturbed sleep, and they also started to exercise less. The good news is that sleep and exercise have rebounded somewhat, but they've not gone back to pre-pandemic levels. Sleep continues to be disturbed for many people, and we see exercise, physical activity rates as low as 30% down from where they were pre-pandemic. And this is going to have long-term implications on our health and well-being. Financial well-being has also been hit hard. 56% of folks, specifically in the US, said that they could not pay a $500 medical bill if they were to receive one. We know that people are losing their jobs. We know that loved ones have lost their jobs. Unemployment claims are up. There are long lines in food pantries, and there's a tremendous financial health hardship happening all around us. So, in the workplace, as employers, we're often focused on how do we help our employees achieve their full potential? How do we help them be creative? Well, the reality is that people are not focused on being creative and achieving their full potential right now. Employees want to have safety, security, and good health for their family. And that's what employers really need to pay attention to. The good news is that employers are getting the message. Willis Towers Watson did a survey and found that 95% of employees said that their senior leaders have demonstrated a sincere interest in employee health and well-being. And as they think about how do they meet the needs of their employees, how do they respond to what employees are looking for, we think there are 4 key objectives on the new employer agenda. Employers have to listen and engage daily. They have to think agilely and move fast. They have to be digital first, but have a human touch. And they have to reinvent themselves through innovation. And I'm going to take you quickly through some examples of what we've seen and what we've helped our clients do during this time. First of all, listening and engaging daily. It may sound a little bit like overkill, but employees are telling us they want to be heard daily. They want to have the opportunity to engage and stay connected. They're feeling isolated. They're feeling lonely. They don't understand what's happening. There's a lot of uncertainty and a lot of confusion. So we've worked with our clients, and we have found that a well-being platform can actually be a way to engage people, to get them coming back every day, to communicate to your people about health, well-being, and safety, and to support them during this really challenging time. We have a client, Edward Jones, and they've done a wonderful job really kind of deploying this strategy. They've been in constant communication with their employees. They've set up virtual meetings, coffee chats, and they learned that their employees wanted resources. They wanted help for financial, emotional, physical well-being. They delivered those resources, and they saw a 40% increase in the utilization of health and well-being benefits. Employees have also told us that specifically they don't want to just hear about COVID. They want to hear about fun and lighthearted content. They want help staying active. They want help staying healthy. They want help eating right. And so we're focused on all of those areas. Employers need to move fast. They need to think agile, and they need to move fast. One of the ways that we helped our clients to do that is the moment COVID hit, our clients came to us and said, help deliver content. We got to react. We got to educate our people. In a very short order, we released a whole new COVID platform for our members. We have actually now over 1 million hits to this website. We've given them content, habits, cards, and challenges, all integrated in a well-being program. We also work with clients to quickly deliver a passport tool that allowed their employees to come back to work safely to track what was happening in their population. Furthermore, we helped our clients to really meet the needs of their employees who are working from home. Musculoskeletal health programs, mental health programs, nutrition, healthy cooking, at-home workouts, all of that delivered in a comprehensive app ecosystem, all during this COVID epidemic. So Josh Burston said that this is an opportunity for companies to really transform their business and their business operations, and we've seen that happening around the world. Digital, of course, has come to the forefront, but what we've also learned is that people still want that human touch. One of the things we've seen in our coaching center, in our call center, is that coaching calls have skyrocketed during this epidemic. People don't want just digital solutions. They want to talk to a human. And anxiety related to COVID is the #1 driver of calls into our coaching center. People want help. They want support. They want to talk to another live human being. We also know that there are a number of comorbidities for COVID that are worsening outcomes: heart disease, obesity, hypertension. And so clients have really started to roll out what we call digital therapeutics. These are digital first, but human-centric solutions that help people with chronic health conditions to manage those conditions and in some cases to reverse them. And we're helping people to improve their health during this time. Finally, I want to talk a little bit about reinvention. Our clients have seen that their employees are isolated, they're lacking social connection, and that's having a tremendous negative impact on their health. One of the things that we worked with our clients to launch during this time is called BP Go. It's a new social competition where people can form teams all around the world, and they can compete to see who can become healthier. And it's a really kind of fun and social environment. We also found that people were struggling to understand all the benefits that were in front of them, how to navigate the healthcare system, where do I go for care, what's covered under my health plan, what's it going to cost me. So we've worked with our clients to deliver a really robust benefits navigation platform to help them find the care that they need. The biggest innovation is we're helping to reinvent how employee health and well-being benefits are delivered, bringing it all together in one platform that we call the Home Base for Health. And this is really a rethinking of a very fragmented industry. Generally, employers roll out lots of content to their employees, lots of programs. Those employees can't find them, they can't access them, they go underutilized. So this is a reinvention through innovation and how to approach employee health and benefits. And I'll conclude by just sharing that we think that the employer agenda is very well aligned to the employee agenda. As employers are listening and engaging daily, employees are actually connecting and engaging with them. When employers are moving fast, employees are also moving fast to embrace new habits and new routines. When they're releasing these digital and human solutions, employees are saying, yes, we crave that, and they're taking advantage. And when they're reinventing how they deliver benefits, employees are quick to adopt these new technologies. We think it's a win-win. We think this is the new agenda, and we're very excited to see employers leading the way. And now I'm excited to introduce our next speaker, Noah Webb, who is the Senior Vice President and Head of Product Innovation for Alexander Mann Solutions.
Rajiv, thank you very much for the kind introduction here. And Rob and Laura and everyone at InnovateWork, please, thank you very much for having me.